Welcome to the second presentation on managing human resource for health. In this particular presentation, we are going to focus on careers in healthcare management of careers in healthcare basically. So by the end of this presentation, I expect you to understand and adhere to ethical standards and legal regulations governing healthcare practices, demonstrate professionalism in interactions with patients, colleagues, and other members of the healthcare team, uphold the patient confidentiality and privacy rights, and finally, communicate and coordinate with the other healthcare professionals, including physicians, nurses, allied health professionals. So having looked at the learning outcome, now let us look at some of the careers actually in healthcare setting. We are beginning with the clinical care careers. So under clinical care careers, we're basically talking about the doctors and the nurses. So when talk of doctors, we are talking about an individual or employee of an organization which is responsible for diagnosing and treating diseases. So they may specialize in particular area of medicine, such as internal medicine. When we talk of internal medicine, we're talking about doctors who are specialized in treating internal diseases, in diseases which affect the internal organs of the body. Then we have the pediatrics. We're talking about doctors who manages diseases in children or kids below the age of 17. And then we have people who work as surgery. We also call them doctors. So under surgery, they basically treat injuries. So when patients are involved in the accident, they have injuries. So the surgery is the one, or the surgeon, actually the surgeon is the one working on them. So these are some of the careers under doctors in healthcare setting. So when talk of doctors, we're basically talking about these people. Now the next one is nurses. So the nurse provide direct care to patients in hospitals, clinics, and other healthcare settings. They perform a variety of tasks such as administration of medication. So the medication is basically prescribed by the doctors. After prescription, then of course the nurse ensures that the patients are taking the drugs as prescribed by the doctor. So that's what you call administration of the medicine. Then taking vital signs and providing emotional support. The signs we're talking about here is related to the sickness. For example, the temperature of the patient, if it is going high, the nurse makes sure that he or she takes the record and then maybe forward it to the doctor for further examination. And also they offer emotional support to the patient. It's not all about medication. Sometimes the patient also requires emotional support. You need someone who will always comfort them, talk positive things instead of always seeing negativity. So a person can recover quickly if the nurse has a positive mind by saying that you are going to be fine, everything is going to be okay, take your medicine, this will end. Things like that makes the patient to gain some energy. But if a person, I mean, if the nurse is not looking at that angle, of course, the person will feel like I'm going to die. What is the use of taking the drugs? So these are some of the careers under clinical when talk about careers in healthcare settings. So the next one is still under clinical is the physician assistants. So the physician assistants are the mid-level healthcare providers who work under the supervision of doctors. In other words, they are not fully doctors, but they work with the doctor. They help the doctor in diagnosis of the diseases or prescription of the medicine, etc. So as a hospital administrator, you need to be aware of these people. They play very crucial role in making sure that patients are recovered because a doctor alone might not do the work. There's a call of nature. The doctor might go outside, leaving the patient in the ward. So it is the physician assistant who makes sure that things are in order until the doctor comes back. And also he helps in making sure that the patient is taking their medicine in time because the doctor will not be there all the time to monitor whether patients are taking their medicines on time or not. So that's about physician assistant as far as career in healthcare, especially under clinical career, is concerned. The next thing is now the support services careers. So when talk of the support services careers, we're talking about the medical assistants. So the medical assistant, they provide administrative and clinical support to doctors and the nurses. So they perform a variety of tasks such as scheduling appointments, taking vital signs, and administering medications. If you have appointment with a doctor, it is the medical assistant who makes sure that your appointment with the doctor happens. Maybe you are coming for medical review. Okay, so it is the medical assistant who makes sure that you meet the doctor to check in the progress of the recovery or the recovery progress. So that's about the role of medical assistant as far as support service in healthcare is concerned. They also take vital signs, the increase in temperature and the other things to make sure that the doctor gets the information concerning the condition of the patient. So we also have the phlebotomists. So these people, they deal in blood testing basically. Okay, blood testing is very important because you may have a patient who is not having sufficient blood and the person needs blood. So for you to get the blood, you don't just get blood anyhow and then give to the patient. The patient might die if you give a blood which is not matching. This is very, very important. It has to be tested. Number one is the blood group, it has to match. If the patient is having blood group A, then you are giving him or her blood group A, O. It's not matching. It means that you are just killing the patient. So they make sure that the blood which is given to the patient is of the same group and also it is free from disease. You're talking about now the HIV and other diseases in the blood. So these are some of the functions of phlebotomists. The pronunciation is a bit hard, but that is what they do. Basically, helping the doctor with testing the blood. The doctor does not need to go to the lab to see to test the group, the blood group. It is the phlebotomist which do that. So that's about support staff. They actually help a lot in the recovery process of patients whenever they are brought to the facility. The next one is administration careers. So when talking about administration careers, we're talking about the managers, we're talking about the logistic, etc. So they oversee the operations of the hospitals, clinics, and other healthcare organizations. They are responsible for a wide range of tasks such as budgeting, staffing, and the marketing. So they make sure that the hospital or the organization has enough budget for smooth operation. They make sure that the hospital, the organization has enough human resource. The human resource we are talking about here are the doctors. The human resource we are talking about here are the nurses, the midwives, the lab technicians, and of course, other support staff. Okay, the drivers, the logistic administrators, the askaris, the cleaners, etc. They all help a lot in the recovery process of patients. So that's about administration career. In fact, this is basically the students who are now doing healthcare management. So you're not going to be there interacting with the patient all the time. You're not going to be there prescribing medicines, okay? Operation, injecting. No. Your work is to make sure that the hospital, the clinic, the organization has all it needs to operate normally. And it is very important for you to know some of these careers. What does the doctor do? Okay. What does a nurse do? What does a lab technician do? So that's about administration career. The next one now is the public health careers. A public health professional work to prevent disease and promote health in communities. That's all. Okay. A public health person is just like an administrator who does not also interact with the patients. It is very rare for a public health worker to inject, patients. Very rare. Their work is basically awareness to make sure there is no outbreak of disease in a community. So they work in a variety of settings, such as government organizations, academic institutions. Accepting the work this weekend. Why is that again here? Is you are making noise? You are making noise for us? Thank you. So that's about the public health careers. It's very important for you to know that they don't interact directly with the patients, but they help a lot in making sure that there is no outbreak of diseases in a community. The next career is now the research careers. So we're talking about now the scientist. For example, the recent outbreak of coronavirus, the people who developed the vaccine are under research careers. They're part of the medical team. They make sure that new medicine, new vaccines are discovered for new diseases. That's about research careers. So the next one now is we are going to look at the types of physicians. Having looked at the careers, talking about the clinical support staff, administrators, and then the public health, now we need to look at the type of physicians. One is the primary care physicians. So we're basically talking about the family physician. This is a person who manages maybe the sickness in a particular home. Okay, they manage the health of individuals, families across all age, providing preventive care. When we talk of across all age, we're talking about from the children to the parents, and if the grandfathers or parents are there, they manage their health. Basically, family doctor. Just like you have, some of you have a family lawyer, okay? You can have your family lawyer, you can have your family financial advisor, those who are extremely from rich family, things like that. Then we have the pediatricians. So they specialize in treating a disease in children. Okay, they are basically trained to manage disease which affect children. Or when kids are sick, that is their work. They don't specialize on parents, but their children. Then we also have the geriatricians. Now these ones they deal with the adults, with the parents of the kids. Whenever you have a disease, this kind of physician, they directly deal with you. The next one now is the specialty physicians. The first one was a family physician, but now this one is a specialist physician. We have cardiologists, they treat heart and cardiovascular system diseases. If you are having a heart problem, you will visit a doctor called a cardiologist. Not all doctors they treat heart disease. We have particular people who treat that. That's why it is called a specialty physicians. So people with the heart problems, they go to see such kind of doctors. Then we have dermatologists. So they manage skin conditions. If you have rashes or fungal infection, they are the one managing your skin. They know better how to treat the skin. Okay. The next one is now gastroenterologists. These are people who deal with the digestive issues. You're eating food, the food is not digesting, you're having constipation, etc. You are supposed to meet a gastroenterologist. The pronunciation is a bit complicated, but that is what they do. The next one now is orthopedic surgeons. They treat bone, okay, joint and muscle injuries and disorders. So if you have a patient who is involved in accident or accident victim, maybe the person has fractured bones, they normally come to orthopedic doctors who make sure that their bones are put in order, they are treated. So these are some of the specialty physicians. Now the next one is the behavioral health physicians. We're still looking at the physicians. We have talked about family, we have talked about a specialist. Now we are looking at behavioral health physicians. Number one is a psychiatrist. They diagnose and treat mental health conditions, including anxiety, depression. So this anxiety, this depression could be because of trauma or other related disease which affects the brain. So it is a psychiatrist, doctor, or physician who makes sure that they put things in order. In other words, we call them, people normally call them majanin in Arabic, Arabic term. They are majanin because they deal with majanin. The next one is a psychologist. They offer guidance on mental health challenges. Now, so psychiatrics is basically mental illness, okay, like madness. But with the psychologists, they deal with the guidance. Okay, we can talk about maybe counseling if you have problems which is disturbing you. You can come to the psychologist, he or she will offer you the service you want. Then we have the social workers. The social workers are individuals who help others cope up with the social difficulties. Okay, you are having problem at home with your one of your family members. The social worker will come in and help you to make sure that you are put in order. You are not feeling lonely. They will come and also give you such kind of support. Then we have addiction specialists. So they help individuals overcome addiction to substance and alcohol. Okay, people who are drug addict, okay, marijuana, cocaine, etc. We have a special physician who handle that to make sure that this guy is deceased from the drugs they are doing. So these are some of the examples of behavioral health physicians you need to know. So having looked at that, now let us look at the collaboration for comprehensive care. We've been looking at different kind of physicians, different kind of profession under clinical career. So now let us look at the collaboration. How do we work together to make sure that the patients fully recover? Because it's all about teamwork. Number one is a collaboration between physicians across both disciplines is crucial for holistic care. When we talk of holistic care, we're talking about comprehensive care whereby every aspect of the illness is tackled. Then integrating physical and behavioral health services can improve treatment outcomes and overall well-being. So it's not sometimes it's not about taking drugs or medicine. A person can be there taking medicine all the time, but if that mental aspect, that mental support, that behavioral support is not given to them, then they will not be recovering because there's a connection. The brain is our engine. Okay. If the brain believes in something different, the brain is ever disturbed, however much you're taking the medicine, it will never work on the patient. So that's why we are calling it a comprehensive collaboration approach. You need to make sure that all the actors who help in the recovery process of the patients are involved, whether they are psychologists, psychiatrists, etc. They need to be involved, depending on the context. Of course, you cannot involve them in every cases, but it depends on the case you are treating, the sickness you are treating. So having looked at that, now we are going to look at the nurse, the role of a nurse, a function of a nurse. Number one is the direct patient care. So the nurse has direct contact with the patient whenever they approach the facility. So they assess patient's physical and mental health conditions. By physical, they look at how the patient is doing in terms of recovering or the gravity of the sickness or the severity of that sickness. Then with the mental conditions, how the person acts is very important in relation to the medicine the person or the patient is taking. So it is the nurse which assesses that and then gives the report to the doctor. Then we have administer medications and treatments as prescribed. The doctor normally prescribes the medication and the nurse ensures that the patients are taking the medicines which have been prescribed to them. Then monitor vital signs and other health parameters. It could be taking temperatures, the breathe, how the person is breathing, etc. Then provide wound care and other nursing interventions if the person is having injury, maybe in the leg or whatever the wound is. The nurse makes sure that that wound is treated. Then offer emotional support to the patients and the families. I've already talked about support. Okay, talking positive things, talking about recovery, be optimistic that the patient is going to recover. That one also helps a lot in the recovery process. The next one now is education and advocacy. The first one was the direct patient care, but this time around, education and advocacy. So, provide patient education on disease management, self-care, and healthy living. If it's about the facility, maybe because of the cholera outbreak. So, the nurse educates the patient on how to avoid this cholera and also how to make sure that the cholera does not spread to the rest of the community. So it is the nurse which educate the patient Then the nurse also assess patient's cultural and healthcare decisions. So if we have some,
There's no internet there. I used to buy, but
please,
there's
you are making
no
noise.
internet.
You are making noise. You are making noise for us.
Because of
You are making
my
noise for
school.
us. Please, I will give you a chance to ask a question later. Then offer emotional support and guidance to patients and families during challenging times. The challenging times is when the person is actually going through the pain. Maybe they have spent a lot of money trying to treat the patient. They are now running out of cash. That's what we call challenging time. Okay, someone is on a sick bed, no money. The medication is expensive, so this is where we need the nurse to come in. Then advocate for patients' access to necessary healthcare resources. It could not be necessarily the hospital where the patient is brought, maybe other partners. So the nurse makes sure that he or she tells that patient where to access.
How we went back. I did one time I told you.
Then promote health awareness and disease prevention in community.
You know this driver, the driver disturbing the driver.
That the community is aware
Now what he did,
when disease
his phone came in,
needs to be done in order to
100,000 written only, for 30 cars.
disease.
Sampa told me.
Then we
He
have
said he's telling me 100,000.
critical care
I
nurse.
thought he saying
Critical care
100,000 for
nurse
what? Now tomorrow,
works in a
soldier doing with
which is called
and Sampa told me, tell this
they provide services to people who are
tomorrow nobody distract.
physically ill. There's a difference
And
between
this is not your job
and
to decide.
being
I'm right, tomorrow I'm the right. Your job
someone who's
is
ill
doing
is at the
this.
point of death could not be
That is your job to do.
could not be talking.
If
But
you don't
someone
want,
who's sick
eh,
can be
there
able
is a problem.
to speak.
Simple. Company is very serious. There is
So
nothing
make sure that if you are a nurse, you
nothing
have to
come.
provide such kind of services to the people who are brought into ICU. One is a compassion and empathy. You need to be putting yourself in the shoe of that person. You need to feel the pain the person is going through. Number two is critical thinking and problem solving. You need to have the ability to assess complex situations to make quick informed decisions because the more you delay, the more chances of the person who will lose. His or her pain to actual a critical nurse. But if you're a nurse who ignores the pain of the patient, then you're not contributing to the success of the recovery, but you're adding the salt in the wound. Then the next one is critical thinking and problem solving. You need to have the ability to analyze complex situations because if you don't make decision in time, the person might die because you're talking about someone who is at ICU, intensive care unit, very ill. The person who's ill cannot talk, is at the point of death. So you need to have the ability to decide quickly to make sure that whatever medication, whatever referral is done as far as possible. Because if you don't do that, the person might lose or his or her life at any time. Then time management and organizing skills. You need to prioritize tasks and manage time effectively. For example, if the person is brought to the facility, what needs to be done first is very important. At what time? So all this contributes a lot to the success of the recovery process of the patient. So these are some of the qualities of a critical care nurse. And the next one is, this thing cannot move. I was not even using cursor. I was not using the mouse. Okay, we are now looking at the key skills of a critical nurse. One is a proficiency in a complex medical equipment. So you need to have the ability to operate ventilators, intravenous pumps, etc. If you don't have such kind of skills, what if the person requires installation of ventilator, which you don't know? It means the person is going to lose his or her life. So as a critical nurse, you need to have such kind of knowledge on how to use such equipment. They are very important. Then pharmacological knowledge is also very important. You need to understand which medicine to give to the patient at what time, and then the effect or the potential effect of the medicine you are going to give to the patient. So that's very important as a critical nurse. The next one now is the infection control. If the person is brought to the facility, maybe because of infectious disease, for example, coronavirus, or even we can talk about yes, coronavirus, which is basically infectious. What do you do? So you need to have the ability to make sure that you disinfect the facility. If it's about the table, if it's about the chair, if it's about any equipment you have used, you need to sterilize it to make sure that you disinfect the place so that the next person is going to come will not be infected with the coronavirus. We can talk about even Ebola. Ebola is also very dangerous. So you need to have such kind of skills as a critical nurse. The next one now is the emotional support, which I've talked about. Emotional support is very important. It helps in the recovery process. You give support to the patient by always being there on time, responding to him or to her. If it means lifting the person, you also need to do that. That's one of the things you need to do to make sure that the person you're managing fully recovers. Now, let us look at the nurse aid. So by definition, a nurse aide is basically an assistant who is under the the supervision of the registered nurse. So a nurse aide works to make sure that the nurse is helped in terms of providing the support to the person whenever they are brought to the facility. Then their duty is to make sure that they assist the person with the personal hygiene, okay, dressing and then feeding. Some persons might not be able to feed themselves because of the gravity of the sickness. So it is the nurse aid which helps the person in eating and even changing their dresses. They might not be having that energy. So the nurse aid comes in to make sure that the dress is changed and also hygiene, may be taking bath, etc. These are some of the duties of a nurse aid. Then reporting changes in patient's condition to the nurse. The nurse might not be there with the patient all the time. So it is the nurse aid to monitor the condition of the patient. If it is worsening or it's getting better, they need to make sure that they report to the nurse. And if it's worsening, of course, the nurse will come in and then change the medication and maybe also involve the doctor in the process. Then performing clerical tasks and maintaining a clean, organized environment. When we talk about clean, organized environment, it's just keeping things in order, disinfecting the places, etc. So these are some of the roles of a nurse aide. Now let us look at allied health professionals. What do we mean by allied health professional? These are health workers who are not physicians, nurses, or even doctors, but they play a very critical role in providing range services to the patients. For example, we can talk about physiologists, people who work on the physical condition of the patient if it matters, and also we can talk about people who help in even communication. Some patients could have problems with the communication they come in and help them. They are not basically doctors or nurses, but their contribution matters a lot in the recovery process of the patient. So we call them allied health professionals. So don't think that they need to have a degree or masters in medication or in surgery. No, they are basically non-doctors. So for example, the physical therapy. A physical therapy assists patients with the regaining movement. Okay, if the patient has been suffering from maybe broken leg, fractured bones, so it is the physical therapy who helps the person to make sure that his movement comes to the normal. After the doctors and the other team have worked on him, the next thing now is to make sure that the movement is normalized. Then we have the nutrition and dietetics. These people, they are not doctors. They just study food values, or we have about we call them the nutrition dietitian, or the specialized people who study nutrition. So they provide dietary guidance and nutrition counseling to promote healthy eating habits and manage chronic diseases. There's some food which is needed for particular kind of sicknesses, so they know better what to do and at what time. That is their role. And you cannot call them nurses or doctors. They have never studied medicine, but they only study food with the values, which helps a lot in the recovery process. Then we also have radiologists. These are people who operate X-ray, okay, image. If you have internal issues, they take the picture of your internal organs, then the doctor can analyze to see where the problem is. So you cannot say that the radiologist is a doctor. He's not a doctor. His work or her work is basically to operate the X-ray machine to identify where the internal damage is. If you have a bone which is broken inside, which cannot be physically seen, but they can be able to be noticed when they use the X-ray. So these are some of the examples of allied health professionals. They help a lot in managing the patients. Now, let us look at the benefits of allied health professionals. Number one is enhanced patient care. Like we have just looked at the physiotherapy, the nutritionist, we have the radiologists. They work a lot. For example, if you are a person who has a broken or fractured leg, they help you a lot to regain your movement after undergoing the medication. So that is a benefit number one. Then they reduce health costs. If you are working in a hospital which is having all these people, it means you will not be referring a patient to another country for for nutrition services, because you already have a nutritionist who can provide the service to the person. By doing that, you are reducing costs related to that. Otherwise, if you do not have, then that means you have to refer the patients abroad, or you have to hire someone from outside to come and administer nutrition program to the patient, which is going to be expensive. Then the next one is that increased access to care. Diverse allied health professionals offer alternative treatment options and support services, making healthcare more accessible and inclusive for individuals with varying health needs. So not that all patients have the same problem. Patients have different issues. Others could be because of pregnancy-related disease. Others could be accident. Others could be mental problems. So all these needs people who are specialized to make sure that you have a fully recovery process. The psychiatrists, they work with people who are having mental problems. You cannot bring psychiatrists to address people who are having a maternal issues. It will not work. Psychiatrists basically work with the people who are having mental issues. That's the benefit of having a allied health professional in the hospital. Now, healthcare support staff is what we're going to look at. They're also very important in making sure that the patients receive the services they want. So what are the types of the healthcare support staff we're talking about here? Number one is the administrative staff. So they keep medical records. They are sometimes called receptionists. Whenever patients are brought to the facility, they are the first person to interact with the patient if it requires consultation with the doctors, etc. That is administrative support staff. Then we have technological and laboratory support staff. People who operate X-ray, they work normally in laboratory. They don't work the receptionist. Their work is to make sure that the image, the internal part of the organ is known by the doctor, so that the doctor can give you the necessary prescription you want. Then the next one is other support staff. We're talking about dietitian, we're talking about nutritionist, etc. They also help a lot to make sure that the meal which is required for you is the best. For example, for a pregnant mother or for lactating mother, there's a special meal for them to make sure that the breast milk is produced in enough quantity to take care of the baby. So such people, they are very important in the hospital setting, especially if you are in a hospital which deals with the maternal issues. So these are some of the support staff in healthcare you need to know as administrators. So having looked at that, now let us look at the roles and responsibility of support staff. One is administrative and clerical support. Like I've told you, scheduling appointment with the doctor if the doctor is coming, I mean, if the patient is coming for a review. It's normally happening in hospital after your first treatment. The doctor will ask for a review maybe after 3 months or 4 months, depending on the gravity of the sickness. So when that time comes, it is the administrative assistant who makes sure that the patient is going to meet the doctor at a certain time to make sure that his or her treatment process is reviewed. If there are any strange changes, the doctor can recommend further treatment. And if everything is okay, then the case will be closed there. So that is the role of administrative clerical support. Basically, managing records, having appointment with doctors, providing information to the patients, etc. Then we have environmental services, maintain a clean and safe environment by cleaning the rooms, disinfecting equipment, and also handling waste disposals. We have, if you work in the laboratory, people come with the samples, if it's blood sample, if it's stool, those one needs to be disposed. It's normally done by the administrative assistant. So don't expect the doctor to be the one disposing the tools or the blood samples to disinfect the area. So it is the role of the support staff. They also play a very crucial role, not just in making sure that the person recovers, but to make sure that the environment looks clean and neat. So that's about the support staff as far as medical staffs are concerned. So with that, we have come to the end of this presentation. And if you have any question, it should be answered later. Thank you so much for watching.